The project came around initially from a visit to the Designing Mental Health exhibition at last year's conference at the Motorcycle Museum. The media wall was demonstrated, and straight away you could see the advantages that this could bring to service users.
The media wall, as you can see themselves, it's enclosed within the wall of Seclusion suite, and the purpose of that is to give an interaction between the service user and the nurses, as well as being an interaction tool for services to use and have access to carers by phone and various apps that are on the media wall. Its main benefit is to relieve some of the boredom within Seclusion. You can see the room is quite bland. I mean, that's something, it's an interactive tool. They can access TV, they can access radio. One of the main features on there is the phone service. They can install numbers on there in relation to the mother or the father. So if they need to talk to someone or even solicitors, then they can contact them via just touching the screen and having a conversation via that way.
Over the next 6 months, we want to work in conjunction with our information governance colleagues and ICT to develop the software to enable us to project service users' information directly onto the screen. The kind of information we want to put onto the screen are service users' care plans, mental health act information, anything where the service user needs to be able to access any written information. It's very difficult when people are in seclusion to involve them directly in their care. So in order to be able to do that, we want to get it onto the screen so that people can have that interaction with the information. Since we've had the media wall installed, we've had a couple of service users utilise Seclusion and utilise the media wall. So what we want to do now on a formal basis is start collating that feedback from the service users to see what impact that's had on their experiences in Seclusion, but also how it's enabled them to come out of seclusion maybe a little bit more quickly and what their recovery has been like.